I'm Kwani Lunis, and I'm joined now by Allison Feaster, the Vice President of Player Development for the Boston Celtics. Thank you for joining me, Allison.
My pleasure. Long time no see.
I know it's been a year or more at this
Yeah,
point.
it has been. It has been. Hopefully the end is near for us to all, be able to reconvene and enjoy some games at the Garden. So I'm excited.
Same as well. And I want to talk about the Celtics last year in 2020. You guys announced a 10-year, $25 million commitment to addressing racial injustice. What role have you played in that process and the execution of that initiative?
I was fortunate enough, once we all witnessed George Floyd's murder on television, I was fortunate enough to be, in conversations with our ownership group with Whit Grousbeck and Steve Paliuka and some others in our organization, Dave Hoffman, our VP of Community Engagement, coach, and a number of players to, figure out a plan of action. We really felt a calling as a community organization to do something to make sure we represent our guys and to make sure we are a good steward of this calling we have. So we got together with a few others and formed this initiative to tackle social injustice and racial inequity in the greater Boston community. So far, so good. There's so much work to do, as you know, but we've had some interesting initiatives coming out of the program already. So.
And to that point, you had five pillars kind of laid out at the beginning when that press release was announced, one of which was equity in healthcare. Why do you
Right.
personally think that pillar is so important when it comes to addressing racism and social
Right.
inequality?
Right. So we have, on the one hand, we have this racial pandemic going on in our country. And on the other hand, COVID-19 has ravaged our nation and the globe. And so, you marry the two, and this equity in healthcare pillar attempts to tackle some of those issues. We have three dedicated co-leads who are kind of spearheading that effort. And this, spread the health, this panel really for us was, a great effort at helping address some of those issues in the Black community.
And you were the one that actually introduced that panel that you mentioned. And one of the recurring themes was the historical implications when it comes to the distrust of Black and Brown communities when it comes to healthcare. From your personal experiences, have you ever had a point where you could understand why people have that distrust in the medical system?
Absolutely. I grew up in the rural South, and I know we never ever saw the doctor. We never went to the doctor when we were sick. It was something that we just didn't do. And so, now fast forward to 2021 when people are encouraged to get what is a life-saving vaccine. And when you look at who's rushing to the front of the line to get the vaccine and who's not, it's staggering. I know my own parents were fortunate enough to get the vaccine, but I know they had conversations with their people in their church community who are predominantly Black, and they had no intention of getting the vaccine until my parents got it. So this kind of wait and see attitude of how it's going to affect some other people or who's going to get it, it's something that we really have to address and to talk about because it's real.
And I love that you mentioned that story with your parents, because a lot of times it's really that lead by example experience when
Right.
people see that someone they know and they trust their opinions to decide to do it. And with the Boston Celtics, a lot of players, people are fans of these players. And the
Right.
thing that I think oftentimes people forget is that before they were athletes or NBA players, there are still Black people, and they grew up in sometimes Black communities as well. What have those
Right.
conversations look like for you with, being a player development VP of the players
Right.
and what they've experienced when it comes to racial inequities?
Well, as it pertains to this particular COVID-19 vaccine, I think the overall lead conversation has been about education. We want to make sure the players, first and foremost, have the requisite education to make, an informed decision. And I think that's how we approached this panel. It wasn't about, oh, here are, two experts, here's a legend and two players. They're going to do it, so you should do it. That's not what it was about at all. I don't even think our players said that they were going to take the vaccine in the round table. I think, it was about really listening to these experts, Dr. Charles Anderson and Dr. Joseph Betancourt, really explain what the vaccine is. They both have had it. And so they were leading by example, but it was really about offering education. So in my role, that's simply what we want to do. Hopefully, once people have the education and can see other people getting it, they'll be comfortable getting it.
And one of the players on that panel, Grant Williams, this is what he had to say about why he thinks the vaccine is so important.
Right. Something where I always say, I don't want to be that person where my career is over because of the fact that I didn't necessarily take the steps to prevent and protect myself. I don't want to be that person that drops the ball for those around me. So not only thinking about my own health, but about the people and the people around me. Like I said, I want to protect them as much as I do myself.
Well, you got to be proud of that.
Such a great soundbite. Yeah.
Right. If you've seen his social media, you'll know that it's public. He got his first shot. I'm really proud of Grant for taking the lead and, first participating in the panel, but just being a good steward of his platform, representing the organization always with class, and just really proud of him.
And I think sound bites like that, and like you mentioned earlier, the panel can really convince people to at least consider it. So with the Celtics United moving forward, what do you see as some of the other initiatives that you think are going to be in play when it comes to helping people at least, again, consider taking the COVID-19 vaccine?
We're just hopefully with this recent announcement, folks will at least take a pause and stop and listen to what the panelists have to say. Hopefully in Massachusetts, the rollout of the vaccine will continue to, go as planned, go smoothly. And we see people of color, all people, because at the end of the day, we're going to all have to have some type of protection against this vaccine so that we can, move on with our lives. So that's what we hope, really.
And for those who want to watch that entire panel, you can check it out on CelticsUnited.com/vaccine. Allison Feaster of the Boston Celtics, thank you so much for joining NBC 10 Boston.
Thank you, Kwani. Great seeing you.